Hello, Assalamu alaikum, and welcome back to another video. And those of you who are new to this channel, so welcome to Quick Fix Dental Course, where my main goal is to help dentists make their careers abroad. Now, I've already made some videos about how to work as a dentist in Canada, UK, UAE, and Australia. So if you're planning to move abroad and still confused where to move, you can watch my videos. It will definitely help you make a decision. Now, in this video, we're talking about the examination details, and this is the second video about working as a dentist in Ireland. And in this video, I'll be giving you complete information about the exam and the references for Ireland Dental Association exam. So make sure you watch this video till the end so you don't miss out any point. Now, on my screen, you can see the examination details, which are posted by the Dental Council of Ireland. Now, let's begin. So the point number 1, 2, 3, 4, we have discussed these points in detail in the first part about working as a dentist in Ireland. So make sure you watch that video so you know what's happening in this video. And in case you missed that video, so I'll provide the link in the description so you can watch that video and then you can watch the examination details part. Now, I'm starting from point number 5. The standard of the examination is no less than the standard of final year dental exam in Ireland, and it's designed to maintain the integrity of the register of dentists in the best interest of patients. Now, the exam, as you can see yourselves, that they say that their exam is no less than the standard of final year dental. So you have to study from your final year books. Now, the exam description is that the exams are held in part 1 and part 2. Now, they are typically held 2 months apart and at two different locations in Ireland. One is Dublin and one is Cork. Now, talking about the part 1 examination. So, part 1 of the exam compromises 3 written parts and also a bench test, a practical examination in operative dentistry technique. So the 3 written papers are as follows. You can see health, disease, and society. Now in health, including but not limited to anatomy, dental anatomy, head and neck anatomy, oral histology, and oral physiology. The disease part, including but not limited to immunology, medicine, microbiology, pathology, pharmacology, and surgery. And society included but not limited to law and ethics, regulation of dentistry in Ireland, and dental public health, clinical evaluation of evidence. Now, what's different about the examination that are held in Ireland is that their paper will typically be in a short answer question format. Now, I've seen this format of exam first time. There are not the basic BCQ type questions. They are short answer question format. And the second part of the exam, because part 1 is held in, like, there are 3 written papers and also a bench test. So the written paper, you can see the 3 written papers will be about health, disease, and society. And the bench test is a practical examination which will test your operative dentistry techniques. So in point number 8, you can see the bench test is a key element of the examination and provides a key opportunity for candidates to demonstrate their proficiency in operative dentistry. So what they're trying to do in part 1, they're trying to cover the operative dentistry and your practical work. So this will be conducted on a mannequin, and you have to perform the operative dentistry related work, which they will assign you, and you have to show them by performing them on a mannequin. Now, proceeding to part 2 examination, a candidate must pass each of the written component and the bench test in order to progress to part 2 of the examination. The part 2 examination also compromises of 3 separate components, which is a written paper, an OSCE, and clinical vivas. And each of these 3 components must be passed individually, and there is no compensation marking within or between the components. Now, the written component compromises of 3 papers as follows. That is restorative dentistry, oral surgery, oral medicine, and child dental health, that is pediatric dentistry. Now, paper will typically be again in the form of a short answer question format. Now, here you can see in part 1, they were assessing your skills on about the operative dentistry, the restorative dentistry, and in part 2, they are testing your knowledge about the restorative dentistry, oral surgery, oral medicine, and pediatric dentistry in a short answer question format. And the OSCE, like you have been giving in your BDS or DDS, the OSCE objective structured clinical examination that will compromise a number of clinical and rest stations, and is designed to assess candidate proficiency in diagnosis, treatment planning, and clinical decision making, in addition to assessment of some commonly used basic clinical skills. And the clinical viva component involves candidate engaging with pairs of examination in a face-to-face setting for assessment on clinical scenarios in the areas of restorative dentistry, oral surgery, oral medicine, and pediatric child dental health. Now, in part two, one thing that is good is that the whole of the focus is only on the same subjects, the written component, the OSCE, and the Viva. You have to focus on the same number of subjects to pass these exams. In part one, there were many different subjects. Now, the management and marking. So I'll just tell you the summary, the important points about this. In point number 14, they say there is no standard setting. Like this is, they have a cut-off mark that divides the candidates in two groups. Now they are below the cut-off and those above the cut-off. So usually what they do is they ask questions to you about some common elements of general dental practice, and the questions that are asking you about the common like diseases and common you can say common elements of general dentistry. So you will have to pass those exams with a higher mark to achieve a pass. That is, in Ireland Dental Association, you don't have any 50%. Like for other countries, or even in your exams, 50% is the passing ratio. You have to score minimum of 50 to pass. But here it's not the case. Here you have, if they're asking you the questions for common elements of dentistry, so you must have more than 50 marks to achieve a pass. And conversely, a question which examiner's knowledge on more specialized area or which is difficult in content may require a lower mark to pass. So if they're asking you about something common, in Ireland, you also have to study what dental diseases are common in Ireland. Now, if they're asking you about that, so you will have to pass that with more than a 50%. And if they're asking you a difficult question, so that requires a lower than 50% to pass. So therefore, the pass mark for exam questions should not be assumed to be 50%, as often it will not be. So this is a thing which makes the Ireland Dental Association exams like really different, because the rules and the way they're conducting their exams I've not seen in any other country. So there it's like really different for Ireland. Now, in point number 15, candidates should not display of unprofessional conduct and behavior during any component of the examination. It will be taken seriously and could lead to a candidate's removal from the examination process without refund. Now, you have to pass part one in order to sit in part two exam. And candidates, point number 17 says candidates will be allowed a maximum of 2 opportunities in which to pass part 1 of the examination and a maximum of 3 opportunities in respect to part 2 of the examination. Now, this part makes it difficult because I think it's not fair, like giving just 2 opportunities to pass part 1 and 3 opportunities for part 2. Of course, it is a very less chance for some people. So I think the exams for Ireland is quite different and difficult too. Now, candidates who are required to repeat part 1 may be exempted from writing a component that they have passed previously. Like if you have passed the bench test, so you and failed the written component, so you only have to give the written component. However, this is true for only part 1. In part 2, you will be required to repeat all the components of part 2, the OSCE, the Viva, and the short question answer format. So now again, this is making the exam more difficult. Now, the further information, this provides the information about the places where the exams are conducted, and it is held once each year. Now, the application date will typically be announced between November and December in a given year, for the examination taking place the following year. So if any one of you is planning to give the exam for Ireland, so you have to make sure that you visit the website again and again in November and December, because they will be posting the dates between November and December in this website. I'll provide the link in the description so you can check it yourself also. And okay, so part 1 will typically take place in March, April each year, and part 2 typically taking place in June and July. So make sure you book your seats prior to these dates. Now, candidates requiring a visa, permit, other to enter and stay in Ireland in order to participate in the examination will be solely responsible for organizing same. The Dental Council has no role or influence in arranging visas or work permit but can provide a letter on request to confirm the purpose and dates of the examination once the date have been confirmed. Now here, the other points are not that important and not related to our examination perspective. They're just telling you about the rules again. And sorry. Okay, so application details at last. So application details, I have discussed these details about the application in detail in the part 1 video about how to work as a dentist in Ireland. I'll be providing the link in the description. So make sure you watch that video if you're confused about the application details. Now talking about the references about from where you have to study for these exams. Now this is the website where they were supposed to post the resources, but I don't know why this website is not working. As you can see, this education overseas dental practitioners, but this website is not working. I don't know why. I've refreshed the page a lot of time, and I've refreshed it in front of you also, but this page is not working. Now, what my opinion is that here you can see they have clearly mentioned that the standard of the examination is no less than the standard of final year dental examination. So you have like a clear view that you have to study from your final year books. And even in other countries where the exam is taking place, they also say to you to prepare from your final year books. So you have to be, thorough with your final year subjects, and you have to read out everything from your final year books. And also, I recommend like don't pick any new book near your exam date, because the wording might be different, the authors are different, so it might confuse you. So you should always use the books that you are using, that you have been using in your final years. And also here you can see this full registration process. We have discussed this again. We have discussed it in the part 1 video. So make sure you watch that video. So now you have a clear view. Now here you can see they have the Ireland Dental Council have a mutual recognition agreement with Canada. So you can also look at the NDEB reference list if you want to prepare for the exam in Ireland. So I'll provide the NDEB reference list here. I can search NDEB reference list. And even in the NDEB reference list, all the books that are mentioned that are from final year, like here you can see. So here is the references. So here are the books they have mentioned, like it's starting from here. It's a very long list, but when you will be looking to through these books, so you will see that you have covered many of the books in your final year. So use your books, use the books of your final year. Now here in the NDEB reference text, they have provided some articles that are posted by American Academy, ADA, American Dental Association. You have to go through these articles. It's very important. You have to go through these guidelines, because the American Dental Association guidelines are being followed almost all around the world, and Canada is following the American Dental Association articles, and the all the guidelines that they say. And Ireland is also like in a mutual recognition with Canada, so there are a high chances that you get questions from this from these articles. So make sure you read these articles. And not only this, if even if they're not following those guidelines, these guidelines are important for you, because they are the latest research materials that are posted by the American Dental Association. So make sure you go through these also. Along with your books, you have to go through these also, because questions come from this part also. And also for you need to go through the Ireland more like a perspective. You should have an idea about the dentistry in Ireland, because in the law and ethics that are being followed in Ireland, you should know that, because here we have discussed that in part 1 you will be asked about the law and ethics. So you should have regulation of dentistry in Ireland. So you need to have an idea about the dentistry in Ireland. And as you can see, the page is not working. The website is not working. As soon as it works, I'll update you guys, but it's not working. So you can Google it. You can Google the guidelines. You can easily find them. But in case you're not find it's difficult for you to look for it, you can comment down below. So that's it for today, guys. If you like this video, please hit the like button and do subscribe to my channel, as I keep coming up with such videos. And it's really really difficult to make videos, especially for Ireland. Like the information available on their website is very limited. Like you can see the references are not clear, but I tried to compile the video and like compile all the points, bring together all the points and applying all the logic that from where the paper can come, because their website is not working. So please, like a little token of appreciation that you can give me is that you can subscribe to my channel and you can like this video. And if you have any confusion, any questions, you can comment down below. You can also comment down below about what video you want to see next. The upcoming video will be about the jobs that are being offered in Ireland to an international dentist, that is not limited to the clinic. You can work in a public practice, private practice. You can work as a faculty member in university. So make sure you watch that video and make sure you subscribe so don't miss out any video. And also in other news, guys, I finally made my Instagram page. So if you want to know more about me, you can follow me on Instagram. And if you want to have the update about the videos, so you can follow me on Instagram. You can message me on Instagram. So I'll provide the link to my account in the description. So make sure you follow that also. And thank you guys for watching. See you in the next video.